sir, can you verify your name and date of birth for me? I'm just going to reach over and check your wristband. All right, today we're going to be putting in a nasogastric tube. What that is we're going to put it through your nose. It's going to go into your stomach. It provides you fluids as well as nutrition and medication since you're not able to take things in orally, okay? Okay. All right. So the first thing I'm going to do is just check your nose here, make sure your nostrils are patent. So I'd have the patient include one and then the other and breathe in. Decide which one's the more patent one. I'd make sure I have an emesis basin and tissue that the patient might need, water for swallowing. You're going to need your NG tube, gloves, hand hygiene, tape, tongue depressor, and then a syringe just to check for gastric contents once you're in the stomach. So I'm going to wash my hands. I'm going to provide a towel for the patient just to make sure no mess gets on the actual gown or the patient himself. It may be uncomfortable, sir, but it will be fine, okay? Okay. All right, so the first thing I'm going to do here, sir, is I'm going to measure from your nose to your ear and then to your xiphoid process. So I'm going to go here to here. And then also I'm going to take the tube and go down the xiphoid process about here. I'm going to make sure I mark the end with a piece of tape just to ensure that I don't go too far and go past the stomach. All right, what you're then going to want to do is go ahead and spray the first 4 inches of the tubing with a lubricating jelly or spray. All right, you're then going to coil the tubing around your hand here to make sure you don't go in too far once again. All right, sir, I'm going to have you tilt your head forward for me. I'm going to ease it in here. Now it's important to offer the patient water. Sometimes when they swallow, it will go ahead and make it easier to insert down their throat, and also make sure you get into the esophagus and you don't end up in their airway. Once you're in about 8 to 10 inches, you are going to want to stop. Take a listen to their lungs. Make sure you don't hear anything that sounds abnormal, meaning the tubing might be in the wrong area. Everything sounds good, of course. So we can continue advancing to the piece of tape here. Just keep dry swallowing for me, sir. We're almost done. All right. Once we're in all the way, we are going to want to go ahead and check for gastric contents to make sure we are in the stomach. To do that, you'll go ahead and need a syringe. Make sure you're not pulling it out of the patient's nose while you're at it, because that would basically defeat the purpose. Put the syringe in, and you'll draw back just to see if gastric contents come out, and of course they do. So we know we're in the right place. We can go ahead and recap this for now. You did great, sir. I'm just going to go ahead and secure this to your nose. You're going to want to make sure the patient can breathe. So what I like to do is make sure the tape's secure. Obviously don't get it in their eye. Whoops. All right. And we'll go around the other side here. All right, so that is NG tube placement. I have to make sure the patient's comfortable. Sir, is this okay? Are you comfortable? Do you need anything right now? You're okay? You don't need to throw up or anything? Okay, perfect.